So health experts have raised concerns with how some organizations have been biasly using certain images to depict diseases in publications. Now, this has been a long-standing trend in which people of color, in particular, have been on the receiving end of these unfair practices. It's been revealed now that women and children are more likely to be represented in ways that are unethical. So to help us unpack the story, we're joined this morning by Dr. Esmita Charani, who's with the University of Cape Town, but joins us from London this morning. Doc, it's great to have you with us on the program for such an important discussion. And it's something that, you know, for those of us who report on issues around, in particular, healthcare, it's something that really has stood out. The unfair way in which certain diseases in particular are depicted when it comes to a visual medium. So for the sake of our viewers, for example, the photographs that go together with particular descriptions of diseases.
Yes, absolutely. Good morning, everyone. It's a pleasure to be here and talk about this important topic. I work in the field of infectious diseases, and this is something that we constantly come across, and most recently with the monkeypox outbreak we saw, which was predominantly in Europe. But there were images of black skin being used to describe the illness and the disease. And we see this all the time in infectious diseases. And it's one particular incident that occurred for us way back a couple of years ago, where we were invited by a global health organization to prepare a set of slides for colleagues in East Africa on the appropriate use of antibiotics in hospital settings. And myself and a colleague from Uganda, Winnie Nambatia, who's a co-author on this work, put together a set of slides. And the organization then told us that they had to apply their branding to these slides. And when these slides came back to us, we saw several images that had no relevance to the work that we were going to talk about. And when we raised this with the organization, we were told, as expected, that this is standard images they use in global health.
So this is something that got you and the rest of your team thinking, and that's when you launched this sort of investigation?
Well, precisely, and specifically about this incident, I took it back to my colleagues at the University of Cape Town, including Professor Mark Mendelsohn and Dr. Oluchi Mobumalo, who's from Nigeria herself. And she pointed out to us these images that were used were of women in Nigeria going to church. Completely irrelevant to the subject matter that we were discussing. And it made me think that I do this presentation all the time to different audiences. I would never use a photograph of a group of women going to church in Europe to talk about this in Europe, for example. So there is a biased way we represent people from different parts of the world.
I mean, continue, please.
But what hadn't happened is we didn't have evidence to back up our assumptions. So we set out to actually collect evidence from publicly available documents. Specifically, global health is very broad. So we've focused our research on documents available in the field of infectious diseases, particularly antibiotic resistance and vaccination, to see how people are represented from different parts of the world.
And you asked such an important question. I mean, the topic that got you onto this issue was around infectious diseases. As you say, the image that was used alongside that was of a group of women in Nigeria going to church. And you asked the question whether a group of nuns, for example, would have been used as well for that story.
Yeah, and you know, it's this othering of diseases. And what we're asking for in this work, and the evidence that we have collected and the tool that we have developed, we really want organizations to adopt it, because image is very powerful. It tells a story, and we want images to continue to be used. But what we would like is that we give the same amount of dignity and respect and equitable and ethical representation to individuals who are depicted in images, regardless of where they are from in the world.
Doc, would you say, I mean, are there ethical standards for this kind of reporting? Are there a set of guidelines that need to be used?
So there should be, and there weren't. And we've taken the first step in developing these guidelines specifically in the realm of global health. When we set out to do this, we realized we couldn't even evaluate the images because we didn't have standards. And this is really important because in medical practice, we have strict codes of ethics for how we interact with patients who often are in vulnerable situations when they come to us to seek healthcare. And that's no different from individuals who go to an NGO or a healthcare organization or a global health team who's looking after people around the world. Is people come to us in the most vulnerable state, And when we go out to represent these people in the work and in the publications or in the research that we do, we should have strict standards and codes of ethics for representation. And we hope that these standards that we have developed will be adopted by organizations as a first step to guide practice of how we represent people from different parts of the world in the work that we do.
And do they seem open to taking on these guidelines, the organizations that you interacted with?
It has been very positive, the reception that we have received. We have been approached by several global health organizations who want to have a conversation with us about how to improve their practices, how to learn. And what has been really positive is some of the photographers whose photos we have featured have also come forward to tell us their stories and the challenges that they face when going out in the field and taking photographs. You know, there's a whole process. So we have to brief photographers too. We have to give them a brief that is has these standards and guidelines and expectations in them. And then it's what happens to these photographs once they are archived in stock image libraries of organizations. You know, Benjamin Chesterton, who's the founder of Duck Rabbit, has been very vocal about this, about what happens to images that we take of people, particularly as part of operations from NGOs and global health organizations. There have been many instances when images of people in vulnerable states has ended up on stock image libraries for sale, and this is completely unacceptable.
Wow.
So what we hope is to have an impact across the whole process of the use of imagery, from the point of briefing photographers for them to go in the field to take photos, right the way through to organizations when it comes to them selecting an image to accompany the story that they want to tell.
Yeah. I mean, this is an important point that you raised there, the taking of photographs of patients in a healthcare setting, and then those photos making it into stock imagery. It brings in the question of patient confidentiality for one, but what is the responsibility of the country where these photographs and where these healthcare settings are situated in?
This is a really important question, and there are many cases, I'm sorry about that, there are many cases where there are countries where the guidelines are not probably set yet in terms of patient confidentiality, or they're not being followed adequately. But that is not an excuse, because we work in a global environment, and I work, and many of my colleagues, we work across different countries, and we know what the standard practice for appropriate and ethical behaviors are, and it is up to us to carry that practice with us wherever we are operating. So the other thing to bear in mind is when we go out to interact with people, with patients and the public in different settings, particularly as a photographer, if you have a UN badge, if you have an NGO badge, the power asymmetries are very different. And it is the person who holds most power in any of these interactions who has the responsibility to ensure that due diligence is given to the right ethical approach to interacting with people and using their images, and giving the individuals the right to be able to consent what is done with their photograph and image.
Yeah, absolutely. It's about perpetuating a particular view of certain parts of the world, right?
Absolutely. And the right of each individual, regardless of where they are in the world, their situation and the color of their skin, their ethnicity, to have the right to dignity and privacy. And this is something that is really important as part of medical ethics and practice.
I find it so interesting in some of the numbers that you've given us in the information pack here. You went over 14 global health actors. You looked at 120 or so of their reports, and the amount of images that were particularly of people in the global south versus those in European nations. It's just shocking. Out of over 1,000, almost 900 were, in some cases, irrelevant photographs.
Yes, and what we identified is 2 out of every 3 images featured a person of color, and children were featured in 3 out of 10 images, and where children were featured, 9 out of those 10 images were of children of color, often with severe concerns around the consent, around the dignity of the child, around whether an adult was available to consent to photograph being taken and what is done with those photos. So it is very important for us. And particularly around children, there are very strict guidelines. I also work in the UK, and if I a healthcare professional go in a hospital ward and take a photograph of a child, that is a complete breach of my practice and code of ethics. I would lose my job. So what we are advocating for is that the same level of consideration is given to people regardless of where they are in the world.
Yeah. The issue of consent, I think it's fair to assume that in the vast majority of those, no consent was given, and even where there was sort of tacit consent, you talked about the power imbalance. If you go into a setting like that where you're wearing a UN badge, it's questionable whether that consent stands.
Absolutely. Absolutely. And these are conversations that we need to be having, and we need to find our way through these questions that need to be asked, right? And we don't have all the answers right away, but we're on the right track now to have these conversations and to ensure that we develop a mechanism for acquiring consent, regardless of the situation we are in, to ensure that people whose images we're capturing know what we do with those images.
Dr. Charani, were you surprised that in 2022, 23, whenever it was that you did this report, that we're still having these kinds of conversations with big global health actors?
No, because we were triggered to do this from our own experiences, right? We knew there is something wrong that needs to be addressed. But I think that particularly with the advent of social media and the loss of control over one's image, right? Once you produce an image, there are so many ways it can be presented and replicated. It is really important we ask these questions and we identify a means to ensure that we follow due diligence in terms of ethics, that we ask these questions across the entire process of selecting imagery in global health. And it may be that we need to go back and commission a whole set of new images that need to be used in global health, considering these important matters that have to be given due consideration around ethics, around representation and equity in representation and dignity of people regardless of where they are in the world.
Yeah, absolutely.
Is not being adhered to.
And getting those guidelines in place and adhered to. Dr. Esmita Charani, great pleasure talking to you this morning. Thanks for joining us. She's in London for us this morning, but she's at the University of Cape Town. Health experts raising the lid on how global health use these images to depict diseases in health publications in an incredibly biased and skewed manner.